Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
Welcome to Gateway Today, the show that talks all things Gateway Community Health Center. I'm your host, David Kash Vasquez, and today we're focusing on one of the most prevalent and challenging health issues of our time, diabetes. The Gateway Diabetes Institute has been at the forefront of diabetes research, treatment, and education for over a decade. We'll talk to certified dietitian Marissa Benavides, who has played a pivotal role in the creation and success of the Institute. Then we'll sit down with Chief Medical Officer Dr. Mery J Cortes, who talks about a patient-centered approach to diabetes management using a wide range of treatment options, including medications, lifestyle interventions, and cutting-edge therapies and research that aim to improve patient outcomes. Our conversation continues with Dr. Cesar Banuelos, a pharmacist at Gateway Community Health Center, who's the driving force of Gateway's Diabetes Institute and specializes in diabetes medications, research, and development. Managing type 2 diabetes in children can be especially challenging as it often requires significant lifestyle changes and close monitoring. We'll talk to pediatrician Dr. Dal Fabbro, who works closely with families to provide education, support, and resources to help children and their parents managing this condition. We've got an exciting show coming your way, so don't move because another episode of Gateway Today starts now. Welcome to Gateway Today, the show that talks all things Gateway Community Health Center. I'm your host, David Kash Vasquez, and today we're focused on one of the most prevalent and challenging health issues of our time, diabetes. The Gateway Diabetes Institute has been at the forefront of diabetes research, treatment, and education for years. We'll talk to certified dietitian Marissa Benavides, who's played a pivotal role in the creation and success of the Institute. How you doing, ladies and gentlemen? We are here at Gateway Community Health Center, and today we are talking about the Gateway Diabetes Institute, and the perfect person to speak about that is, of course, our registered dietitian, Ms. Marissa Benavides, who is in the house, in the flesh. And Marissa, when we talk about the Gateway Diabetes Institute, people are automatically thinking, I'm going to walk into a building, I'm going to see a clinic like Gateway, but that's not really the case, right?
No, you're correct. So actually, the Institute is a set of policies and procedures that our administration has put together to make sure that when a patient living with diabetes walks into any one of our facilities, that each person that touches that patient, whether it be our clerk, our MOAs, our providers, myself included, our pharmacists, that we're all providing the latest standard of care for them to ensure that they have the best quality care for their diabetes possible.
So ultimately, in a nutshell, Gateway Diabetes Institute is the collaboration of multiple individuals, multiple departments coming together to help these patients dealing with diabetes see a better tomorrow.
Yes, and The research shows that multidisciplinary care is the gold standard. And so when each provider and team member is working together on the same page, then we do have better outcomes and better care for our patients. Living with diabetes is a challenge. There's a lot expected for patients that do have diabetes from labs, medications, education, routine medical visits. And so when we're all working as a team, the patient benefits, and it makes it easier for them as well.
Hey there, David Kash Vasquez from Gateway Community Health Center, inviting you to get your COVID-19 vaccine. Right now, Gateway Community Health Center is offering COVID-19 vaccines at no cost to all of our patients. Simply visit any one of our Gateway clinics and get vaccinated. Or you can go to our website, gatewaychc.com, to get more information, or call 956-795-8100. Remember, walk-ins are always welcome. No appointment necessary. Get vaccinated, stay safe, and keep those around you protected. Now back to our regularly scheduled program.
How different is this institute from anything that you've seen in your medical career? How do you put your spin on it from the dietitian standpoint?
Well, I'm glad you asked. There actually is no definition for Diabetes Institute. So when Elmo said that he wanted to create a Diabetes Institute, we scoured the internet. There's no definition. So when I first came on board here at Gateway, my primary role was to make sure that our diabetes self-management education program was accredited or recognized nationally, and we achieved that. And there's a lot of steps to provide quality diabetes education and support. And so we use that as a framework because we do need to have administrative support. We need to have quality improvement as part of our diabetes self-management education program. We also implemented those same steps in our Diabetes Institute, and it has proven to be very effective. And since we've implemented these policies and procedures, the outcomes for our patients, the improved blood sugar management, improved metrics as far as lab values and ease of use for our patients has significantly, it's improved. It's worked.
What are the results that you're seeing from these patients? What's the feedback that you're hearing?
Well, I guess the best thing I could do is give you an example of what that looks like. So, for example, one of the things that we work on is decreasing patient barriers, institutional barriers, and provider barriers. And so when you are dealing with medical care, all three of those issues do arise. And so our organization has come together and made it a priority to decrease barriers in those three areas. So for example, access to affordable medication, that is a patient barrier. And so we have implemented steps to make affordable medication more available to patients. Another example might be transportation to access those medications. So we've implemented telemedicine and telehealth so that patients could apply for medications from their home instead of having to travel. A third example might be insulin adjustments. Many of our patients, after many, many years of diabetes, do need to take insulin, and that's just a normal progression of the diabetes. Being able to self-adjust, having the provider, the educator, and the pharmacist all teaching the same techniques so that the patient could take their time to find the right dose for them to get the best results is another opportunity that we've corrected as far as barriers for providers as time-wise. It's helped a lot. So we've seen improvements across the board with those changes.
Well, my hat's off to you and the team, as always, doing a phenomenal job in trying to save lives and change lives. And so that's what this whole program is about, ladies and gentlemen. It's all about creating access, all about creating better outcomes for all of our patients. And we encourage you to visit our website, gatewaychc.com, to learn more about the Gateway Diabetes Institute. Marissa Benavides, registered dietitian right here at Gateway Community Health Center. I thank you, Marissa.
Thank you so
for your
much.
time, and thank you for watching.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
So the Institute isn't a building, it's a set of policies and procedures. Well, taking a patient-centered approach to diabetes management is crucial in achieving the best outcomes for those living with the condition. Joining us now is Chief Medical Officer Dr. Mery J Cortes, who will talk about a wide range of treatment options available, including medications, lifestyle interventions, and cutting-edge therapies that Gateway Diabetes Institute is implementing to improve patient outcomes.
Dr. Cortes, thank you for your time. I appreciate you being here. Tell me about the Gateway Diabetes Institute. Tell me about the treatments specifically that patients see when they enter our facility.
Thank you, David, for having me. It's a pleasure. So a little bit of a background on the Diabetes Institute. We decided to create this institute because we are seeing so many diabetic patients, and we wanted to give them the same treatment in every single of the clinics that we have around the city or around the counties. So we created it in 2020, right before the pandemic, and what it is the same clinic, it's the same Gateway clinic, but we have delineated processes and how to treat the patients. So once you are here in the clinic and you are diagnosed as diabetic, right, there's going to be a set of standing delegation orders or a set of orders that we are going to implement to see what are you at with your diabetes, right? Is it type 1 or type 2? Have you had a retinal eye screening? Have you had a urine test to see if your kidney is functioning well or not? So everybody should leave the clinic with all the same test, at least to see where you're at. And then treatment-wise, well, depending on the patient, right, and the level of complication or the level of control that you are in the diabetes and other factors.
I've often heard that our Diabetes Institute really is next level because of professionals like yourself or Dr. Banuelos or any of the other folks that are involved in the Diabetes Institute and the development of the Institute. They're constantly pushing to that next level, like to stay on the cutting edge of what's new in treatment.
Yeah. And I wouldn't say it's different. What I'm saying is we are pushing to be on top of all the new guidelines, on the new developments, what's new for the patients, right? And what is different here in the clinic, we have insured patients and uninsured. So usually if you don't have insurance, you cannot afford the latest drugs that are available in the market. But here in Gateway, we have the pharmacy that is discounted prices. We have assistance to the patients for the newest medications, and sometimes they just pay $25 or less for these medications. So they're getting top of the line treatment and it not necessarily being insured. So they're not in disadvantage when they come here to a clinic.
What would you say is the next step for the Diabetes Institute?
Unfortunately we cannot cure it, but we can control it, and definitely we want to see our patients understanding the disease and what's in their power to do. The Institute wants to advocate for the patient and empower the patient to take control on their health. And also we have been seeing better control in our patients. When we started measuring, or right before starting the Institute, we had, I think it was 40% of uncontrolled diabetics. Recently, we were checking at the end of 2022, we were at 25.6. And the HERSA, that is our funding, the federal funding, source, they're requesting that we are 25 or lower. So we are right there.
You're right goal. on the line.
Yes. And I'm pretty sure we're under 25, but there were some hiccups, right? But for this year, that's what we're gonna do. Really
hats off to you and to your team and your staff for constantly pushing to be the best at managing and being stewards of patients who have diabetes, and obviously cures, right? You all want to cure this disease, and so I thank you for that. And I thank you for your time. If you want to learn more about the Gateway Diabetes Institute, you need to visit our website at gatewaychc.com. You can come visit Dr. Cortes and her staff here at the clinic. And again, if you're interested in becoming a patient of Gateway, simply visit our website, click Become a Patient, and you will be able to enjoy high quality healthcare at its finest simply by starting your journey on our website. Make sure you visit.
Our thanks to Dr. Mery Cortes for her time and insight into the Gateway Diabetes Institute. Well, the development of new medications for diabetes is essential to improve the quality of life for those living with the condition. And joining us now is Dr. Cesar Banuelos, a pharmacist right here at Gateway Community Health Center, who is driving research and development in diabetes medication for the Gateway Diabetes Institute. All right, ladies and gentlemen, we are here with Dr. Cesar Banuelos, and today we are talking pharmacy, all things pharmacy, with regard to the Gateway's Diabetes Institute, and how medication is really a huge component of the institute itself. And Dr. Banuelos, thank you for joining us. I want to get your insight into the Diabetes Institute and how pharmacy really supports Gateway Diabetes Institute itself.
Thank you, David, for having me. Pharmacy has come a long way. More importantly, like the pharmacotherapy aspect of diabetes has really made this enormous transition from where we were a couple years ago. Back in 2008, the FDA send out a guidance to all these pharmaceutical companies telling them that they basically needed to conduct certain trials that would look to see if the patient was at risk for cardiovascular disease if they took a certain medication. Based on that particular guidance, we got to see this transition to something miraculous, I think I'd like to say, because when I used to practice as a physician assistant in 2009, we were tremendously limited with the amount of therapies that we had. And even then, we would put patients on multiple agents and we still wouldn't get to goal. But something happened where we started to get these new drugs, these agents such as the SGLT2 inhibitors, the GLP-1 agonists, the famous Ozempic that we see in TV a lot, and other therapies that are nuanced, such as tirzepatide, which is this new medicine you might know it as Mounjaro. And I think pharmacy is key in implementing this and trying to keep everybody up to date with the newest therapies and trying to get our patients to goal, not simply just a numbers goal, but a life goal, which is try to prolong life and try to delay the onset of certain complications associated.
How do you see the Diabetes Institute evolving from where it's currently at? What do you see that's a promising factor from a medication standpoint? What are you excited about for the Diabetes Institute and the patients that we may have to treat in the future?
So I think the biggest thing right now that I think is taking a hold of is that whole chronic kidney disease phase, because this is something nuanced. This is something relatively new where we could delay that onset. I think that is, a big factor, because now we have, before we just really had, we call them ACE inhibitors, which are ACE and ARB inhibitors, ACE inhibitors and ARBs, which were essentially to treat hypertension and this whole proteinuria. That was pretty much what we had, and then now we have two other agents on top of that, so I think for such a disease state that really didn't have much. Now we have almost 3 things that we could potentially give a patient. And then the other thing that I see is this whole take on trying to delay the onset or also possibly treat diabetes in the pediatric population. Now we have, GLP-1s that are used to treat, diabetes and possibly obesity in this pediatric population, but also in the future, these SGLT2s like Jardiance and Farxiga also will have an indication to treat diabetes in the pediatric population. They're looking at trials. It's not said and done yet, but that's a possibility that could come. From these particular trials. They're in stage 3.
And reduce childhood obesity, because that's a big deal, and ultimately reduce diabetes altogether, right? So if you want to find out more about the Gateway Diabetes Institute, we invite you to visit our website, gatewaychc.com. Dr. Cesar Banuelos, he is a educator of all things medication, pharmacy, and of course a big mentor to a lot of our clinicians here as he scours the literature and looks for the latest and greatest when it comes to medications. We want to thank you for your time and your insight into the Gateway Diabetes Institute. And of course, make sure you follow us for more and check out our podcast where you can get more of this content online at Gateway today.
If there's somebody that cares about medication and research, that's Dr. Cesar Banuelos. Well, managing type 2 diabetes in children can be particularly challenging, requiring significant lifestyle changes and close monitoring. To discuss this topic, we're joined by pediatrician Dr. Dal Fabbro, who works closely with families to provide education, support, and resources to help children and their parents manage this condition. How you doing, ladies and gentlemen? We are here at Gateway Community Health Center's North Clinic with our pediatrician, Dr. Dal Fabbro, who's also certified in obesity medicine. And today, as part of our journey through the Gateway Community Health Center's Diabetes Institute, we wanted to speak to you, Dr. Dal Fabbro, about type 2 diabetes in pediatrics, right? It's a big question, right? There's a lot of questions that we have around that and how we're trying to prevent that from everything from obesity in pediatrics, right? Our kids and diabetes as well. So tell me a little bit about what our kids are facing right now and what the numbers are telling us.
Yeah, good morning. So that's a very interesting conversation because we have been seeing in the last few decades, in the last few years, an alarming surge in diabetes type 2 in pediatrics. So just to go back a little bit, diabetes mellitus, right, is when you have elevated blood sugars, right? So your sugar, when you check in the blood, it's gonna be high. So diabetes can be caused by, some lifestyle problems. So because it's a problem with the blood sugar, what usually happens, you have issues with the insulin. So we have 2 main types of diabetes mellitus. So we have type 1 and type 2. So insulin is a hormone, right, secreted by the pancreas, and the insulin is gonna work like a little key to open the cell so the sugar can go from the blood to the cell for the cell to use that as a source of energy. So we need the sugar, right, to survive. Is a source of energy for our body. However, sometimes we have issues with the insulin, so the sugar cannot go into the cell and stays there in the blood, causing the diabetes, the elevated blood sugars. We have type 1, which is, an autoimmune process. It's not that much related to lifestyle changes. Your body's pretty much gonna destroy the pancreas. It's an autoimmune process, and then you're not gonna have the insulin, so your body's not gonna be able to use that sugar. And we have the type 2 diabetes. And going back to your question, in type 2 diabetes, you're gonna have a resistance to this insulin. So you have insulin, your pancreas is gonna work not that well, and you're gonna have resistance to that insulin. So what's gonna cause that? That's when the lifestyle and the recent increase in obesity is playing a role. So when you have obesity, especially accumulation of fat in the abdominal area, when you don't do any exercises, you would lead a sedentary lifestyle, overeating, and of course there's genetic factors that play a role. You can have resistance to that insulin. So even though your pancreas is working, your body is not able to use that sugar, and you accumulate that in the body.
What are the treatments through the Diabetes Institute, through Gateway's Diabetes Institute? that are being effective for our patients?
Yeah, so in pediatrics especially, prevention is the key. So one thing that we have to focus on is prevention. And the Gateway Diabetes Institute, one of our main focus in kids is prevention and early detection. So if we see that a child, we see an increase in the weight and increase in blood sugar, we can start treating them for that, right? So early detection and prevention, that's the key. So the Gateway Diabetes Institute, we're gonna focus on that, right? So kids, me as a pediatrician, we do see kids every year for their physicals, and we are going to help them identify what are the risk factors, and depending on the situation, we can recommend children to have blood work done. So here at Gateway, we also do blood work, right? We can do everything here. We can check for cholesterol, for the sugar levels, right? For diabetes, we can do everything here. Once we identify children with risk factors for diabetes or with elevated blood sugar or diabetes, we can start the treatment, which involves, changing lifestyle, exercising more, eating healthier. We involve our nutrition services. We have a great resource here at Gateway for our patients. We have a nutritionist in-house that can help patients address those things that we can change with the diet. A lot of kids with obesity, they also deal with overeating because of anxiety or depression, low self-esteem, and those things we can address with counseling. Here at Gateway, we also have counselors that, are gonna help patients address those issues. So it's everything, it's multidisciplinary. It's the medical providers, the nutrition services, the lab that's gonna help get the information from the blood, and the counseling services, everything together to help those kids as well.
It's the beauty of the Gateway Diabetes Institute all coming together, pharmacy included, and using the latest and greatest in medicine and the developments. Dr. Rachel Dal Fabbro, our pediatrician here at Gateway Community Health Center's North Clinic. Make sure you visit her, Dr. Dal Fabbro. Thank you for your time.
Thank you so much.
Appreciate it.
Have a good day.
Eye-opening. Our thanks to Dr. Rachel Dal Fabbro for her insight and her time. Diabetes is a serious issue, not only facing adults, but our children are at risk. And it's up to us to take action and step up. That's going to do it for us on today's episode of Gateway Today, but we want to remind you, if you'd like to find out more about the Gateway Diabetes Institute or would like to become a patient, simply visit gatewaychc.com and take control of your health. Don't forget, you can catch a full rewind of our episodes of Gateway Today on our YouTube channel. Simply scan the QR code right here with your phone, and don't forget to smash the subscribe button. Till then, we thank you for watching this episode of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.